the next hour or so. So, by means of introduction, for those of you who don't know me, my name's David Anderson. I'm the Managing Director of the Flight Safety Foundation BARS program down here in Melbourne. One of the things that we do is we try and facilitate information sharing and safety information. Message there. You know, best practices and things like that through our community. We had our technical advisory committee last week, and we had a great introduction in the area of mental health and particularly best practices in mental health, which is what this session is all about. Dr Tony Merritt gave us an introduction on it, and this one is our second of the two presentations for 1 hour, talking about all the different things for best practices in mental health. Obviously, 2020 was a challenging year for everybody. Some of us coped quite well, some of us struggled, and I dare say some of us struggled a fair bit in trying to work our way through all the change and the pressures that came with what the pandemic has wrought on us. Through the graciousness of one of our BARS member organisations, they put us in connection with Tony, and that's where we are with this best practices guide for mental health issues. So Tony will talk for about 50 minutes. There'll be about 10 minutes or so for question and answers at the end. So if you want, please feel free to ask a question throughout the session, but there'll certainly be plenty of time at the end. So with that as the introduction provided, I'm going to switch my camera off and hand over to Tony to take us away. So thanks very much, Tony. Please go ahead.
Great. Thank you very much, David. Thanks for the kind introduction. So I think Janita's going to be looking after the slides for us tonight. So thanks to you, Janita, too. So just by way of an introduction, my name's Tony Merritt. I'm a clinical psychologist. I'm based in Sydney, in Australia, and so I've been a clinical psychologist for about 20 years, and we operate what in Australia is a relatively large kind of corporate psychology company, as well as a kind of traditional clinical psychology business. And about 5 years ago, I became involved in the aviation industry, purely by chance, really, for a meeting with a chief medical officer of one of the airlines here. So we're probably the main psychology provider in Australia, or one of the main ones for Qantas, Virgin, Jetstar, and a few of the other kind of smaller organisations. And we're also part of a collaboration of mental health professionals called Aviation and Maritime Psych. And that's really just a bunch of people who've got together to try and share ideas and improve the lot of people working in the aviation industry. I should say these things are very difficult, but if please do feel free to jump in with questions at any time. Or any comments as we go through. I know that's often difficult to do, but it's an open invitation to do that, so please do. Okay, Janita, if you wouldn't mind moving to the next slide, please. Great. So as David said, this project started when I was working with one of the members on something else, and we started talking about aviation mental health, and the idea really that there's not really a great deal in terms of guidelines for best practice in this area. So the project we were doing, we decided to take a step back and put these guidelines together. And so this is where this has come from. And of course, you know, aviation contracting is extensively used around the world. Traditionally, aviation has always been very focused on safety and risk management. But since the sort of German wings incident, there's been this seismic shift in aviation and about how mental health is considered in the context of aviation safety. The interesting thing is that many interesting things that come out of German wings. One of them is it's still unclear what mental health problems the pilot who was involved in that had. There's been one of the reasons for that is because Germany's got some of the most strictest confidentiality laws in the world, and so it's very difficult to access medical records, even in the case of a significant emergency, but a significant incident. It is clear, however, that despite sort of earlier discussions, that that the person involved, it wasn't depression as such. because people with depression don't fly planes into mountains. He may have suffered from depression as part of his problem, but he had a much more, I think, probably a much more complex mental health presentation. But certainly since then, there's been this big shift. And so that we do a lot of work looking at risk management, mental health risk management for aviation organisations. And coupled with that, there's been a huge social change in the last 20 years about the role of mental health in sort of organisational well-being and in society generally. The World Health Organization now says that depression is the leading cause of non-fatal disease burden in the world. What effectively that means is it means it's the most expensive disease of diseases that don't ultimately kill people. And of course, depression does at times, and when people are suicidal. The other illness that's considered along similar levels of depression is diabetes. They're the two kind of major, two most expensive diseases worldwide. And so for organisations, looking after their staff from a psychological point of view makes absolute sense from a bottom line point of view, as well as obviously from a sort of social obligation point of view as well. So next slide, please, Janita. Oh, and on that previous slide, one of oh no, actually, I'll talk about this here. So looking at the kind of various things that constitute best practice, the first sort of set of those issues relates to organisational culture. And the first of those really is having a safety-sensitive culture that includes the concept of mental health. Say even 5 years ago when I started working in aviation, I went to an aviation psychology conference and thought I was going to see all this juicy stuff about pilots and mental health, and the entire conference was about dials and buttons and positions of things in the cockpit and so on. And it was all about this sort of, you know, what was called human factors. But I was quite surprised to see how much it missed this other aspect of human functioning and human factors. As an aside, that led me to, because I'm a clinical psychologist and we're trained in the sort of research and evidence-based side of things, I was asked to do a presentation on aviation mental health at the next conference, and that led me to do some research on aviation mental health. And I was astounded actually how little academic research there is that's been published on pilots and mental health. Really, there's very little at all. And I suspect that's partly due to the sort of the commercial sensitivity in this, but also to do with the fact it's just such an underdeveloped field. So this idea of a safety-sensitive culture is enormously important, and it's traditionally been associated with more sort of technological and performance-based stuff. But what we know is that psychological functioning, impaired psychological functioning, affects the entire system in an organisation. So it affects the individual, but more importantly, it leads to all kinds of difficulties. It leads to additional pressure on managers to try and manage those situations. It leads to staffing issues. It leads to roster problems. It leads to interpersonal difficulties. It leads to demoralisation in the organisation. And also, as I said, it can be very costly as well. So it leads to a kind of a stress across the system, as well as impairing the individual. And even kind of moderate levels of psychological ill health are associated with impairments in cognitive functioning, and so frontal lobe functioning, memory. It results in fatigue. So one of the most common symptoms of depression is fatigue. It affects decision making. So again, depression makes people approach decisions in particular ways. And anxiety makes people much more focused on risk and danger and threat. And generally speaking, it impacts people's overall functioning. So it impacts how they relate to others, how it relates to their family members, their engagement in leisure activities and pleasurable activities, and so on. Okay, next slide, please, Janita. So even mild to moderate mental health problems have been shown to have a consistent impact on attention, memory, concentration, working memory, and a range of other cognitive functions. And there are lots of tests around that can detect these kind of impairments in cognitive functioning. One of the interesting things about when you're dealing with professionals when it comes to mental health is that the biggest problem for organisations isn't necessarily about people being off work because of mental health problems, so absenteeism. It's a concept called presenteeism, which is people showing up but not really showing up. So them showing up and being kind of, half engaged or 3/4 engaged. That's a problem if you're an organisation and you need your individuals to perform highly. But it's a particular problem if you're an organisation and you need your individuals are dealing with the safety of sometimes large groups of people. And of course, an individual's emotional state will have a big influence on a range of decision making, from technical-based decisions right through to how they deal with people in the cockpit, how they deal with air traffic controllers, and so on. We know that sleep and fatigue are strongly associated with performance, and both of them can be problems that stand alone as their own, but they're also often symptoms of other problems like depression, alcohol misuse, and so on. And what you see a lot in aviation professionals is they're very comfortable talking about stress, sleep and fatigue. And I think what happens a lot of the time is that often causes psychological problems to go undetected because there are so many focuses around these two particular things. What we need to understand, though, when we're talking about psychological problems, most people fear, when we talk about psychological problems, most people fear things like bipolar disorder and schizophrenia and kind of major addiction and that sort of stuff. But actually, the majority of psychological problems, so around about 90% of psychological problems, are captured by depression, anxiety, and drug and alcohol. So not addiction, but just having problems with drinking. And the good news is that all of these problems are quite easily helped and treatable by organisational type interventions as well as kind of psychological interventions. Next slide, please, Janita. We need to understand that that mental health is not a binary concept. So particularly in licensing type contexts and medico-legal type concepts, we like the idea of being able to say that someone either has a problem or they don't have a problem. And when it comes to medical issues, it's much easier to do that. But when it comes to mental health, it's not like that at all. In reality, all of us at some point in our life will experience periods of anxiety, periods of being down or feeling flat, or probably periods of drinking too much or possibly even using recreational drugs. So it's not an all or nothing thing. And individuals move between levels of psychological well-being and health throughout their life, in much the same way that we think about physical health problems. So one of the things I would encourage you to do is start trying to think about psychological problems in the same way that you think about physical health problems. That is to say that most people will suffer from a physical health problem at some point in their life. And similarly, most people will suffer from a psychological problem at some point in their life. So in Australia, the figures are that in any given year, 1 in 5 people will suffer from some form of psychological problem. And throughout their lifetime, 1 in 2 people will suffer from a diagnosable mental illness. So what that means for organisations is that if you want to keep people and you want to engage your staff over the long term, you've actually got to expect that this is going to happen. In the same way that someone might have a period of ill health that might take them off work or may require them to pull back on work for a few months, it's going to be pretty normal for people to have a period of psychological ill health during that time. And we need to set ourselves up in order to deal with those things as they occur, rather than reacting to them as being strange things that have kind of come out of nowhere and they're unexpected. The other thing to take into consideration is the vast majority of mental health problems are in the mild to moderate range. And what that means is that they're often contextual. So what you'll find is that a person may have a problem at work but not at home, or they may have a problem at home and not at work. And that person's functioning is going to be quite reactive to what goes on in their life at that time. So they're much more likely to be perhaps functioning well, but then impacted by stressful events that occur in the workplace. The good news is that the vast majority of people will overcome mild to moderate mental health problems and return back to full functioning. If we said 1 in 2 people are going to have a diagnosable problem in their life, then 1 in 2 people are not off work. In fact, the figures around in Australia show that probably less than, in any given year, less than 5% of people will have a mental health problem that persists for more than 12 months. So really, we need to have a reasonable expectation that people are going to have problems. It's going to be relatively short-lived. They'll be able to adapt to that with the right type of help, and they'll return back to full functioning. And in fact, will probably return back much more resilient, in the same way that breaking your arm often leads to a stronger arm. And what's really important in recovery from these kind of things is having a social environment that provides good types of social support. But from an employer's point of view, being able to be aware of what's going on for the person, so you can have a bit of a sense about how severe something is, and therefore have reasonable expectations for recovery. Okay, next slide, please, Janita. The other aspect of the other significant cultural issue that comes up regularly is really important is this concept of self-disclosure. This was a quote by one of the chief medical officers of one of the regulatory authorities that we deal with, when I was talking to him about the concept of self-disclosure and how he thought about it. And he said it's quite a simple question. He said, how can people engage with mental health resources and services without feeling they're putting their licence at risk? In Australia, we have a very good regulator, and they are very aware of mental health issues. I'm also aware that people are dealing with regulators around the world, and there's a lot of variation in how regulators approach this kind of stuff. But more and more regulators are understanding mental health problems in a much more nuanced way, and are able to deal with people much more effectively. So what we need to do is we've got to think about, how do we create a culture that makes it easy for someone to put their hand up and say, yep, I'm struggling, I'm having a bit of a difficult time, I need to make some adjustments. Okay, next slide, please, Janita. So what does that look like? Well, there are some kind of basic kind of principles, really, you can think about putting in place. These are the kind of things that are going to massively increase the likelihood that someone's going to be willing to step up and say, yep, I'm having a problem. First one is fairly obvious. So leadership models, leadership that models open discussion about mental health and well-being. So it shouldn't surprise you if I say that the way a leader acts reflects the way people within the organisation react. And so leaders being open about their own psychological well-being and functioning, and being willing to have those kind of conversations on a regular basis with people about how they're doing, are modelling appropriate behaviour. We need to have a consistent approach to psychological and physical ill health. And so I mentioned we need to be thinking about psychological health in exactly the same way that we think about physical health. Most of the time, if someone breaks their arm, they'll get some help, evidence-based treatment, hopefully, and they should return to full functioning. Every now and again, someone keeps breaking their arm, or they break their arm and it doesn't fix properly. And for those people, then we need to think about whether they're still in a position to be able to perform their role. And psychological functioning should be thought about in exactly the same way. We certainly need to work hard, and organisations, I think, need to work much harder to educate the regulators on how they approach mental health. And a lot of the drive in Australia for the regulator to change their view of this has come from the chief medical officers of the big aviation companies, who've really brought about some significant changes both in Australia and in New Zealand. And I know there's similar stuff like that happening overseas in other Western countries. It's really important throughout the organisation to stop using pejorative or stigmatising language. Even using words like nuts and crazy and things like that might seem like they're funny, but they're significant barriers to people putting their hands up and coming forward when they have a problem. One of the things that's kind of really important in aviation, and we see this a lot in people we work with, is setting up structures that allow the capacity for an individual to take themselves offline without need for excessive justification. So it should be okay for an individual to say, you know what, I just need to step down for a few days and have a bit of a break, and then to be able to do that without being pushed about what the issues are. It's really important that when people do that, that they receive paid leave and support. And paying people for taking time off for mental health issues should be a relatively short-term thing that employers have to do, but it comes back in spades if it means that highly trained person stays in work with you over the long term. And you need to have strong peer support programs. And I'll talk about peer support programs a little bit later. But just suffice to say, I think the European regulator, and certainly in America, more strongly so in Europe at the moment, are saying that peer support programs are now probably an essential part of any aviation provider's mental health strategy. We move to the next one, please. And then there's some barriers. So these are kind of kind of related to the previous slide. So punitive regulatory authorities, and there are obviously that's probably one of the most significant barriers to people being willing to put their hand up and say they've got a problem. Strong beliefs about mental health and licensing, and there are a lot of myths that permeate the aviation industry about mental health and licensing. In Australia, one of those is that anybody who puts their hand up about depression will lose their license. That's a very commonly held belief by aviation professionals, and woefully inaccurate. Aviation companies often select for people with obsessive and perfectionistic traits, and these are the kind of traits that actually get in the way of people putting their hand up and coming forward. So obsessive people tend to be very detail focused, but they also tend to be thinkers rather than feelers, which means that their awareness of their emotions is often less than the general population. They're also highly perfectionistic. And what that means is that they find it very difficult to admit small flaws or problems in themselves. There's high levels of health anxiety in aviation compared to the general population, and this obviously is driven partly by the strong focus on things like fatigue and sleep. But what that does is it means that aviation professionals are much more likely to pay more attention to problems of their health and attribute psychological difficulties to physical health rather than understanding that they might be related to mood or anxiety and so on. And then the final one obviously is management attitudes towards mental health. And so if the management have discriminatory attitudes towards mental health, then it's not surprising that employees would struggle to come forward and talk about things. Okay, next slide, please. So I'm just going to go into some of the kind of key support structures now. So I want to talk a little bit more about peer support programs because, as I say, so in Australia we have the PAM program, the Qantas PAM program, which is sort of one of the gold standard peer support programs, and has been running for as long as things like Project Wingman in America. There's a bunch of characteristics about peer support programs that stand out amongst the successful ones. One of the things about peer support programs that's really cool is that they're low cost, they're early intervention programs, and they have high levels of credibility. One of the reasons they have high levels of credibility is they tend to be run by pilots for pilots. So these are the sort of successful programs. And obviously confidentiality is kind of really central to that. What you find is that pilots tend to be relatively accepting that other pilots have high standards of confidentiality, but often when you see engineers and even more so cabin crew, there are a lot of concerns about confidentiality among those groups of people. And then the successful programs tend to have a structure that is broadly independent of the employers and the unions, but at the same time supported by funding by employers and unions. So again, in Australia, what happens is that the Qantas PAM program has funding from the union and from Qantas that goes into a pot of money. It's not a huge pot of money, but it's enough to support the program. And then that money is administered and run by the pilots for the pilots. So it's an independent structure. And in fact, in Australia, the peer support program is actually a limited company. And Virgin have got a slightly different structure, but it's the same kind of principles. And then it's really important to support the peers and train them. So having really kind of high quality training initially for the peers to be inducted into the program. So that typically involves understanding of mental health, understanding of the kind of supports and treatments that are out there, what expectations are about how it works and how people get better, but then kind of training people in, I guess, what gets called kind of soft counselling skills, which is really kind of how to listen, how to engage, and how to be supportive. And then in addition to that, we train people in things like understanding about concepts of confidentiality, about boundaries, personal limits, and those kind of things as well. And then it's really important for that training to be to continue on an ongoing basis. So typically what you might do is you might have training for the peers every kind of 3 to 6 months, and also facilitate mechanism for the peers to get together and communicate and support one another. Most successful peer support programs have mental health professionals backing them. So I have colleagues of mine in the UK, in America, and Canada who are all involved in peer support programs with organisations. And typically they do a couple of things. They train the peers. They provide a sounding board for the peers. So if a peer is struggling with a particular issue, they can contact that mental health professional and talk through with them how they might handle it. And then they provide a referral source. So if the peer is struggling and the individual needs to see a psychologist, then they'll be able to be referred to a psychologist who's an aviation professional who can help with that problem. It's very helpful for there to be a mechanism to feedback data trends from the peer support programs to the employers and unions, while obviously maintaining confidentiality. So the kind of stuff that gets fed back is, we've seen an increase in sick leave or stress leave amongst people at a certain base over this last 3-month period. And obviously the employers find that very useful to understand that kind of stuff without it giving away any information about what's happening for individuals. Next slide, please. And then what's really important, I think, and often organisations miss this, is having access to aviation medical professionals. So obviously the sort of DAMI system is set up to allow large numbers of pilots to have their periodic capacity assessments and receive their certification for their licence. The problem is in many countries is that sort of DAMIs are not aviation specialists. So they often tend to be general practitioners, and often they see actually a relatively small number of pilots each year, and they often have this kind of quick kind of assessment, kind of checkbox kind of approach. So organisations that do well with mental health have connections with aviation medical specialists, and these tend to be people who are part of a sort of faculty of aviation medicine, and they have very good understanding of the various factors and licensing issues, but they also have very good skills in the identification and management of mental health issues, of drug and alcohol and so on. And these people tend to be people from areas like general practice, occupational medicine, rehabilitation medicine, and psychiatry, who've gone on to do additional training in aviation mental health. So I would encourage any organisation who's interested in improving their performance in these areas to seek out an aviation medical specialist and to work with them on a regular basis. Next slide, please, Janita. And then, of course, you always have to have good psychologists working with you. Psychologists in training are not trained in aviation issues. As I mentioned, I got into this about 5 years ago and had the good fortune of meeting someone who said, that's okay, we'll teach you about aviation and the way it works. So I learned about all the various things about licensing and shifts and concepts like seniority and so on. And they're really important kind of concepts for psychologists to understand. So what I would encourage you to do is, if you are interested in this, is to look to try to identify a local psychologist that you could perhaps work with, and then work to skill them up over time to help them understand better how they can work with you and how they can work with aviation professionals. As I mentioned, that certainly overseas, places like the UK, US, Canada, those kind of places, there are very experienced people available who are kind of part of our network. Next slide, please. Employee assistance programs. So most employees who are kind of on the moderate to large size tend to have EAP programs, and they cover a whole kind of swathe of things, as you'd probably be aware. While smaller providers, if they get EAP, it tends to kind of revolve more around counselling services. The problem with EAP is that pilots historically have been quite reluctant to engage in EAP, to see EAP providers for a whole bunch of reasons. And if anybody is working with an EAP provider and they want some help in working out how to work better with them from a mental health point of view in an aviation, I'm happy to talk to you about that. But suffice to say that a good peer support program really can function to take up most of the kind of roles that EAP programs are traditionally set up to take on around these things around counselling and support and so on. Okay, next slide, please. as you would all know, I'm sure, that alcohol is always been a problem in aviation, and continues to be a difficulty that lots of people struggle with, both air crew, cabin crew, and support staff. Even in engineering, it's got a higher prevalence compared with the general population, I understand. It's really important, I think, if we're thinking about how we deal with alcohol, to really be able to differentiate between a problem and addiction, because the approach to those are really quite different. So if someone's got an alcohol or substance problem, we often refer to that as kind of misuse. One of the difficulties with misuse is it often flies under the radar, because it's often seen as being a kind of someone who just socialises a lot, and rarely do you see the person drinking at kind of unusual times and kind of unusual places. And for these people, usually it's that their drinking is to excess, and that because they drink to excess, it tends to impact their performance on an ongoing basis. Addiction is quite a different thing. Addiction is where the person uses a drug or alcohol and they can't stop. Typically they may be drinking in the mornings, and it leads to significant problems in their life, relationship problems, workplace problems, and so on. When it comes to misuse, that usually can be managed through kind of standard kind of approaches of working with an aviation doctor, of working with a psychologist, cognitive behaviour therapy, those kind of things. But addiction really does require referral to a specialist service. And the reason that is because there is a significant medical aspect to addiction. One of the common things is someone drinking, is if they stop drinking too suddenly, then they can have seizures. And that can, potentially be fatal. So when it comes to addiction, that definitely needs to be managed much more by a kind of specialist addiction service. Can we move to the next one, please? Aviation has a really interesting program, which has primarily been seen in the United States. So the HIMSS program, so the Human Intervention Motivation Study. Only an pilot would have named a drug and alcohol program the Human Intervention Motivation Study. In the US, since the 1970s, over 6,000 pilots have been through the HIMSS program, and they have a reported return to work success rate of 85%. That's a startlingly high figure. It really is. You don't see that in any other, any other context when it comes to addiction. And so that's a very, very successful program. And HIMSS is gradually rolling out around the world now. The other program that's a sort of evidence-based program for aviation is called Birds of a Feather. And this is a support group for people who've got addiction problems, sort of run along the lines of Alcoholics Anonymous. The HIMSS program is much more kind of peer support driven. And there's a HIMSS conference in the States every year. Next slide, please. And then we move on to, if you could go back one, please. And then we move on to resilience and wellbeing training. So there's a sort of concept in mental health of mental health literacy and skills training. And really what that means is that everybody in organisations have a base level of understanding of mental health, and they should have base level skills in being able to deal with their own mental health or being able to kind of help others. And kind of resilience and wellbeing training really kind of taps into that kind of area. So on one level, it's teaching kind of basic understanding on awareness of mental health and what kind of skills people can use. And the skills are often really kind of straightforward. So, for example, it's a really interesting statistic that says that when it comes to mild to moderate depression, 12 weeks of exercise on a regular basis, 3 or 4 times a week, and only kind of light exercise where sort of heart rate's around 60% of maximum heart rate, so you can still hold a conversation. So that level of activity is as effective as mild to moderate as antidepressants for mild to moderate depression. So these are the kind of things that people kind of need to know in order to manage their mental health better. But I think because of the specifics of aviation, it's really important that resilience and wellbeing training is adapted to the industry. I know that the foundation is working with, I think it's the Kiel Institute or Kiel Foundation, which is a British organisation, to develop some really good kind of resilience and wellbeing training that's being tailored specifically to the aviation industry. And then there's this thing about sharing successful case studies, and the sort of gossip is often the currency in many organisations, and it's very easy for kind of bad stories of badly managed situations and problems to get around organisations. I think it's really important that we try to counter that sort of stuff by sharing successful stories for people. And that could be, there's lots of different ways that success stories can be shared. Often actually having someone who's been through problems and has successfully come through it with the help of the company is a really powerful kind of advocate to have. And when we run mental health programs and groups in our business, we often get in people who've had these kind of experiences and get them to come in and talk about kind of what they've done and how they've got through. This morning I was talking about a case of a aviation professional in an Australian organisation, and this person was charged with a very serious crime and was arrested in a very public way. And it would have been very easy for the organisation to just walk away from this person, but they didn't. They chose to support them. And because this person's flying was very important to them, it was clear that actually keeping this person at work and flying was really crucial for their mental health. So the organisation committed to that and supported that person, and eventually they were cleared of all the charges that were put against them. What that meant now is that this person is a really powerful advocate for the organisation and for how they deal with things, and they're quite happy to talk to other people about that. So I would really encourage you to look for success stories and to share those within the organisation. Next slide, please. And so these are the sort of common characteristics of resilience and wellbeing training. So education about common mental health problems, education about the role of stress in mental health, evidence-based guidelines for alcohol use, and these are changing all the time. Information about where to get effective help. So what is a psychologist? What is a psychiatrist? How can a GP help? What are medications? How do they work? And then the kind of principles of self-care, how to deal with thinking in a healthy way. So this kind of idea of, healthy thinking, strategies for creating a meaningful life, and then specific skills like communication skills, assertiveness and sleep hygiene. So these are kind of the basics of resilience and well-being that really everybody should get. If you're a young kid now and you're going to school and you're 7 or 8 years old, this stuff is being weaved through life for young children quite regularly. But for adults, if you're over 30, you wouldn't have got this kind of stuff, and so you've really got to learn it for yourself. Okay, next page, please. And then the final thing in the support and treatment side of things is having a systematic approach to suicide and suicide risk. So a few kind of principles here. So any suicide or self-harm related talk should always be taken seriously. Sometimes there's a bit of a tendency for people to say that someone is just attention seeking, but we shouldn't be taking that approach. And behaviours of concern should be discussed immediately with an appropriate person as soon as possible. Discussed as soon as possible with an appropriate person. So whether that's a manager or it's a psychologist, a psychiatrist, a doctor, or so on. And certainly it's really important within the organisation to always make sure that there are emergency mental health contact information available. Now, I know that's much easier in an organisation that's based in a large kind of developed country than organisations that are based overseas in smaller, less accessible locations. But it's really important, if that's the case, this next point is even more important, that you have very clear risk escalation policies in place. Because when these things start to happen, and they happen quite quickly, you need to be quite clear about what you're going to do. There's a lot of organisations that provide basic training in mental health emergencies. So in Australia, it's called Mental Health First Aid, and they're kind of brief training programs in teaching people just how to respond to this kind of stuff if it happens. A lot of EAP providers have manager assist programs, which means that managers can quite quickly contact someone to get advice on how to handle things. And really importantly, going back to this thing about self-disclosure, it's really important to have a non-judgmental culture so that people can be as able as possible to put their hands up when things are tough. There's a really interesting statistic that says that 85% of people who successfully suicide had contact with some form of helping professional within the last 48 hours. It's a startling figure. And it means that particularly with things like peer supporters, that there's a real opportunity there to massively reduce the risk of suicide. And then if someone does successfully suicide, it's really important that employees get appropriate supports. And sometimes employers miss this step and think that only people that were immediately associated with it were affected by it. It's really important that the ripples of this kind of stuff can spread through an organisation. It's important to understand. Okay, next slide, please. Okay, moving on. So financial issues. So we need to make sure that insurance policies are inclusive of mental health disability. So, you know, employers need to make sure that that workplace psychological injuries are covered in the same way that physical injuries are covered, and the income replacement policies should at the very minimum cover common mental health problems. Even today, in big commercial airlines, end-of-career insurance policies often don't cover severe mental illness, or even have kind of mental illness as an exclusion criteria. And I think we need to change that in order to, we need to kind of remove that discrimination. And until we do, it's going to be very difficult for people to take seriously that they need to deal with these kind of problems. The financial stuff needs to be taken care of. And when people have financial stresses, of course, it always accentuates their problems further. Next slide, please. And the other thing that's really important is that we offer paid leave for people with mental health problems. You need to understand, as I said before, that most people who go off work for a mental health problem will go off work for a relatively short period of time, a number of weeks to a couple of months. And employers should be able to expect that that person has is going to have a kind of full return to functioning. And certainly most aviation regulators, when someone puts their hand up and says, I've got a problem, most aviation regulators are going to ask that pilot to probably take a step back from flying for a while and work on that problem. Typically in Australia, that's often 4 to 8 weeks if it's a diagnosable psychological problem. And it's really important that, that the aviation professional knows that they're going to be paid if they put their hand up and say they've got a problem. As a psychologist working with people as well, I can tell you that if people are being paid when they are off work for mental health problems, it doesn't in any way, or rarely does it, cause people to drag their heels about getting back to work. What it actually does is it increases their engagement in treatment because they can not worry about that particular issue. And as I said, most employers can expect people to return back to work relatively quickly. Employers shouldn't expect that paid leave would be ongoing long term. It needs to be just available for people to make short-term adjustments in order to get back to work as quickly as possible. Next slide, please, Janita. And then the final area I just want to talk about is governance and licensing. So in order to have effective mental health strategy, you need to really weave that into your corporate governance and have mental health governance as well. So things like having leadership buy-in, having evidence-based policy processes in programs, having a focus on risk management that includes mental health, this idea of a culture of continuous improvement around mental health, and having empirically validated performance indicators. These things are all related to mental health, are all kind of key principles of good governance that really need to be applied to mental health. And part of that, therefore, is also making sure that there's meaningful feedback from employees on mental health and how that's dealt with in an organisation. Next slide, please, Janita. So connected to that, there are a number of organisations around the world that conduct mental health audits. And so in Australia, the Black Dog Institute, which is kind of like our national kind of depression institute, conducts audits. So its audits are conducted around what it calls its 5 pillars. So leadership, policy processes, education and support, and risk reduction. So I've got my commas in the wrong place there, I've just realised. And risk reduction. And they will give you so they'll look at those key areas. They break them down into sub areas. They look at what strategies are in place, articulate gaps, make recommendations for improvements, and then they would conduct an audit in 12 months' time as a follow-up to see how you were going. And they're very collaborative in how they work with organisations. The good thing about the Black Dog Institute's audits is they're relatively simple. They're not these kind of 100-page documents. They keep it in a really, really nice, simple methodology. But around the world, there are lots of organisations that provide these kind of things. Next step, please. Licensing issues. So I've talked about this. It's really important that experienced aviation medical examiners work with your organisation, as well as having this kind of knowledge and this of the knowledge and the membership of often a kind of local medical aviation college. They're very good at having oversight of clinicians working with aviation staff, so they can coordinate teams when the problems are more serious. They can organise the clinical psychologist, the psychiatrist, the drug and alcohol, the medical health problems, and put those things together in a cohesive way. And one of the things we know is that as problems get more complex, so kind of team-based approaches become more and more important. And aviation medical specialists are very good at that kind of stuff. So yeah, I think that's probably all I want to say. So next one, please. Yeah. And then the final thing is really about just making sure that you are using evidence-based information, so good quality data to help people, to help dispel myths around mental health. Now, I realise that there's a lot of variation around the world, and some people here are possibly from organisations where they have pilots working in very isolated sites. So I do understand that, but there are certainly, from my experience, a lot of myths that permeate the aviation industry about mental health. So these are two that are kind of quite common in Australia. So one of them is that a pilot will permanently lose their licence if they have a mental health problem. And I've met hundreds of pilots who say they know someone who lost their licence due to a mental health problem. They put their hand up and they lost their licence. The fact is that of 25,000 licences issued in Australia in 2018, only 15 of those resulted in the loss of licence due to mental health problems. And in that particular year, I worked with 4 of those people, and so that doesn't mean don't work with me, by the way. So I worked with 4 of those people, and all 4 of those people had really serious problems. And 2 of those people were people actually who chose themselves to give up their licence. That was actually a self-choice. So, but this myth permeates the industry, and it really does create a problem for people putting their hands up for self-disclosure. Second one is that antidepressant medications will result in licence loss, and most likely permanently. Regulatory authorities around the world are now fully, many of them are very conversant in the fact that some antidepressants, in particular SSRI antidepressants, are very unlikely to interfere with workplace performance for pilots. And so many regulatory authorities in the world now will allow pilots to fly on SSRI antidepressants. In Australia, that's after an 8-week period. So I just put these 2 up as examples really of the kind of myths that are around, and how it's really important for organisations to work on dispelling those myths in the aviation industry. Thanks, Janita. I think that's pretty much on time. So just to say that if I can help in any way, please feel free to reach out. My email address is on here. I'm a big fan of the pay it forward culture, so I'm really happy to provide any help or support or advice that anybody's got, anybody needs, if I can help in any way. Thank you.
Great. So this is David back online. Thanks, Tony. Absolutely outstanding and wonderful information. We got one message in the chat line there, and I've got another question for you. I'll start, and just while people gather their thoughts, and I encourage any and all questions, but and especially with the group that we've got here, and I know Tim and Duncan actually, and Vivian that we spoke to at the beginning, they're in sectors of the industry where they have a rotational basis. So people will be on a you know, a 3-week or a 4-week tour of duty, sometimes in remote locations. So are there any particular elements that have a better or stronger focus for people who are on a rotational basis of the elements that you had there?
Yeah, it's a good question. I mean, I think obviously, you know, there are specific challenges for people from a mental health point of view that do shift work, you know, and I mean, certainly, and I've said this isn't about, we don't need to worry so much about major mental health problems, but things like bipolar disorder, shift work is a major risk factor for people who've got kind of major mental illness, you know. So when it comes to, you know, minor stuff, even kind of, you know, those sleep disruptions and, you know, fatigue and even just being displaced from your normal kind of environment, they're all risk factors for just kind of turning the volume up on people. So I think one is we need to be aware of those kind of things. And I think what that then leads to, first, I think is a greater need for people like that to be trained in resilience and wellbeing. So they've got a better understanding of themselves and what goes on for them and how to deal with those kind of situations. And I think the second thing is about this encouraging this concept of peer support programs. So that, because if they're out doing that kind of stuff, they're likely to be around people like them, you know, and that's really where the peer support programs come into their own, I think, is those in the big sort of commercial airlines, you know, they just talk about, it's those coffee shop conversations that go on, you know, that's really where the power of kind of peer support is. So I think they're two things that I would definitely highlight. Yeah. All
right, great. Thanks, mate. We got one in the chat line here. I'll interject that one from Fahad. It says, does mindfulness training present a solution to aviation human capital issues on a global scale? How do you have the mindfulness there?
Well, that's a lovely statement, that is, isn't it? I really like that. That's really cool. Yes, how about that? So look, I think, yeah, I mean, like mindfulness now is, you know, something that's become huge in the last sort of 10 years. And it you know, sort of started off, I mean, for a long, you know, mindfulness has got this whole kind of connection with Buddhism and spirituality and so on. But what we've learned in the last 10 years is there's such a thing called the mindfulness as a skill, you know, rather than a kind of spiritual experience. And that skill is a universal skill. And it is a base skill for dealing with stuff psychologically, you know. And in fact, again, kids in school learning it now, you know, they're learning to meditate and be mindful when they're 4 or 5 years old. So I think, yes, I like the sort of, you know, the sort of global solution idea, because I think it's central to that kind of resilience and well-being training, you know. So mindfulness teaches you how to sit with yourself. It teaches you how to notice what's happening for you and become aware of what's happening for you, and it teaches you how to be calm and centered, you know. And that can be, and those things are really helpful, and you can use mindfulness anytime. You don't have to be in a cave for 48 hours, you know, kind of learning how to levitate. You can actually use it 2 minutes when you're sitting in a chair waiting to get on a plane. So yeah, I think it really is a really general base fundamental skill that everybody should know.
All right, wonderful.
Great question.
Yeah, it is. I've got one more here. To detect mental health issue in the early stages, could we use screening test instead of a psychological test? Is there anything along those lines?
You can, but I guess you've got to, you've got to have a mechanism to administer a screening test, and therefore you've got to have some suspicion that there's something happening with someone. You know, and I think if you've got a suspicion that there's something happening to someone, the best mechanism for that is to sit down with someone who has got good listening skills. You know, that's really that's the best way of doing it. You know. You know, there's various other things. I mean, there are, you know, we've done a lot of work for a couple of commercial organisations doing pre-employment screening for mental health issues, and I know that's something that European Aviation Authority are quite interested in the moment. You know, in the end, there's no one approach that's going to work fully. You know, I think you need a mix of stuff, really. But in the end, a colleague someone being willing to say to a colleague, hey, I'm not feeling great, that's the best tool. That's the best tool.
Yeah, that's a wonderful one. Actually, speaking of tools, it's a great segue into another question for you. And we got a prolific group here this afternoon.
Yeah, it's nice.
Has there been any work done in the sphere of engineering? Some interesting dynamics around the engineering community, in particular that cause us to consider them specifically in the context of this discussion. That's from Duncan Moore. There is a different dynamic, as you mentioned, with the folks in the engineering department. But any particular work that comes to mind?
No, there isn't. I mean, what I've seen so far is that the organisations that I've seen, they start with pilots, and then they go to cabin crew, and then they go to engineers. So I think that the poor engineers have really, been left on the back foot with this stuff, unfortunately. My sense is, though, having kind of met a few engineers, that they are different people to pilots, and they are different people to cabin crew, and they have different issues. But their job is absolutely safety critical,
Yes.
And so really, I think we need to be turning our mind to these things. And I do think that it's probably important to have, strategies and programs that target those three groups in different ways, But I think the principles are similar all the way across, And in particular, again, this sort of peer support thing I keep coming back to, because I think aviation does peer support better than any other industry I've seen, and it really works really well. So I would be encouraged, certainly from an engineering point of view, that's where I'd be starting. I'd be sitting down and saying, how do we get a really good peer support program going?
Yeah, I know the work that you mentioned with Nicole from the Keel Centre with the resilience training. They've tailored it for the different communities, so the outcome is the same, but the way that you get to it is tailored for the different groups there, and it just makes it more appropriate and connected to the individual who's going through it. So we got a nice compliment there from Tim Rolfe. Great presentation, thank you very much. Apart from having open communications between management and employees, are there things that can be measured as useful organisation indicators, such as psychological safety? And that's probably relevant because we do talk a lot now in our industry about the culture of the organisation. And I know from an auditing point of view for us, that's a challenge, because it's very difficult to audit culture, and even more challenging if somebody writes up a non-conformity about it. But what about markers of organisational psychological safety? Even if it was not,
I think there's lots. I mean, there are some gross measures, like things like sick leave and those kind of things. At the sort of the downstream end, probably the most potent measure. I mean, again, I don't know how this works in different organisations around the world, but probably the most impotent measure is the cost of your workplace injury insurance, and because obviously a lot of those insurance policies are costed around claim histories, and so you can, and the thing about them is that, a psychological injury claim is a very expensive injury compared to a physical injury claim, and so even reducing those by a small amount is a really good marker of a broad, program success, I think. They're two broad measures, I think. And in the end, for a lot of organisations, the hip pocket is the most powerful argument, right? So so that's two kind of simple ways it can be done from financial.
All right, very good. We've got another one from Andreas. Usually local civil aviation authorities have a punitive approach to aviation professionals with mental issues. How and by who an effective discussion should be initiated in order to change their approach? That would be a challenging one, I think, probably from your role, but have you got any, because you mentioned that Australia has got a rather forward way of looking at mental health issues, and certainly, again, from an organisation that looks at operators in multiple countries around the world, there's a huge diversity in the
Yeah.
let's call it the maturity level of the way the regulatory authority operates. But any ideas come to mind on that one about how to start that conversation with the authorities?
Yeah, so what I've seen in Australia over a 5-year period is that I guess the senior medical aviation people and some sort of representatives from pilot groups started getting together with the chief medical officer of CASA in Australia, and I attended one or two of those meetings. And here, because we're relatively large, we have some of the busiest domestic routes in the world. So we actually have a very big aviation industry comparable to the size of the population, And so they've run some small conferences and workshops where they got a bunch of interested people to get together and start sharing ideas about things. And the regulator was in on that, quite regularly. In the regulators, and again, I don't, obviously they're different around the world. I can only talk about the Australian experience. Is that the regulator here has a chief medical officer and has other medical people involved, and they're the place to start. Some of the more regulatory and legal based people are probably not the place to start. Because they've got a different role. So that's what I'd be doing, is I would be getting together the senior medical people, union people, pilot leaders, getting them in a room with the chief medical officer and saying, how do we facilitate a culture in which pilots are willing to put their hand up and say, I've got a problem? And I think the regulators they may be punitive, but they'd be very interested in that. I think they'd be very interested in that issue. Yeah.
Yeah, as you're talking through that, I'm thinking there's probably a role for the Flight Safety Foundation in there to facilitate those sort of initial discussions and the like.
I'm sorry. I think you've got to frame it in that kind of way. Like, how do we get pilots to put their hand up about safety risk? How do we do that? And I think I would imagine most regulators are going to be interested in that.
Yeah, all right. Oh, the job for us to continue that idea along. So, hey, thanks for the question. I missed the name there. Who was that one? From Andreas. You started a good thought process there. For those that are interested, Keith Piggott has posted a link in there for, it looks like a South African one that might be able to help. So there. All right. Hey, well, I won't say that I've run out of questions, but certainly they've stopped feeding into the comments line, and we're a little bit over time. Okay, one more there. We'll wind one more in, and then what we'll do is we'll take that. Okay, then I think this one is pretty short for me. But do you think peer support is effective to handle early mental health issues?
I think that's where peer support's power is, really. In that kind of, if you look at I'll try and do this quickly. If you look at the growth of a mental health problem, it often starts off with something simple, right? And if left unchecked, it starts off as a family problem, maybe, develops into a problem that then starts to manifest at work. If work isn't able to support that person, or doesn't provide the structures for that person to be able to kind of move forward, then work starts to become a problem as well, and eventually the problem gets lost, and it becomes about everything. What you then start to see is people putting in claims for workplace injuries, and at that point things have got really, really bad. So peer support can really step in early in that process and take someone away, like you can head off the problem and really keep it in that kind of mild to moderate range. And I can't speak highly enough of a process that stops someone ending up in court over a workplace injury, because that's devastating for everybody, Yeah,
very entirely. All right, wonderful. All right, well, hey, I think we've I won't say, like I said, we won't exhausted all the questions, and I'm sure people have got more. But what I'd suggest is, if anybody's got more questions or more inquiries, flick it through to our office. You've all had correspondence from Juanita, and we can put them together and pass them across to Tony. Now, did we see your last slide on there for your connection details also? So there we go. Yep. So there's Tony's contact details, and by all means, contact Tony directly if you've got a question, inquiry, or a thought bubble, which is what I suffer from a lot of hey, I should do this or try something like that. By all means, contact Tony. So
you can also find me on LinkedIn very easily as well. If you just look on there, you should be able to find me easy enough. Yeah,
all right, brilliant. Hey, as I said at the beginning, this opportunity came from us, from one of our member organisations who said, hey, we've seen this, we've used this is fantastic, and it's a great portal to use the BARS program and the Foundation's opportunity to talk to a wide range of people. So a big thanks for Cameron and the folks at BHP that recommended it across, and I've been enthralled with it. So, and I've seen it twice, and I'm still picking stuff up. So thank you so much. Yeah, so a huge thank you for your time today, Tony. I'm sure we'll be doing more work together in the near future. And as I said, for anybody else out there who's got a question, please feel free to fire it across. So with that, I'll let the folks on the European time zone kick off to work and have their breakfast as off they go, and people on this side of the world can retire for the evening. So once again, thanks very much. Thanks for everybody who's joined us for today or this afternoon session. It's been truly wonderful, and I'm privileged to have been a part of it. So thanks a lot, Tony. Appreciate it.
Thanks for having me. Thank you.
All righty.
Thank you, David. Thank you, Tony.
Thank you.
Thanks a lot.